now that many states are either fully reopened or partially reopened, but we're also seeing spiking case counts in upwards of 20 states now, is there a point at which those states that are in trouble should shut back down again? This was a question we posed to various experts, and it's really a very hyper-localized question, so it has to be assessed on a localized basis. And by that I mean the triggers for knowing when to perhaps consider shutting down again would be looking at especially whether the hospital system in a particular area is likely to run out of space for patients, equipment and supplies to treat patients and protect healthcare workers available to work. If they become infected, they would no longer be able to treat patients, obviously. So this is a very localized phenomenon. So even if overall, for instance, a state has enough available hospital beds, that overall state count is less important than whether individual hospitals are well equipped to address the patients specifically coming in from their area. So if there's a high number of hospitalizations occurring and this one hospital is becoming overwhelmed, or this one hospital system, that specific area should perhaps consider a shutdown. For instance, Phoenix is kind of on this track where specifically the Banner Health hospital system in specific counties is becoming extremely overwhelmed, totally saturated with patients. And they're going to run out of supplies. ICU beds are full. So for instance, Phoenix might be a place where you would consider shutting down the greater city and surrounding areas somewhat, restricting travel, restricting business, all that sort of thing. Of course, given that many states are partially reopened, experts did address that it, of course, will be difficult to reinstate lockdown after lifting it somewhat, both on a logistical level, but also getting people to adhere to a shutdown after restrictions were lifted. So more moderate measures might be placed instead, which might include obviously limiting the number of people that, for instance, are allowed inside parks, inside businesses, rather than shutting down those venues completely, or charging people with misdemeanors for not wearing a mask. This is already used in a number of states, but mask wearing is not specifically required in public in all states. So that would be a basic measure that could help people manage outbreaks as they happen. And we do see in other countries, for instance, Japan is a good example, where they didn't necessarily institute a super strict lockdown, but they took basic public health measures, common sense health measures that we've known throughout the pandemic now, to deal with the spread of the virus, and their case counts and hospitalization rate has stayed low. So no one has argued at all during this pandemic that a total shutdown is the best solution. But if people cannot adhere to the basic public health measures, then lockdown becomes the only option.